Hi, everybody. I am Sebastian De La Rosa, and on behalf of my team, I will be presenting on high emergency room utilization in the US. Let's get to it. So, what exactly is the issue at hand? Well, simply put, emergency rooms are being used too much and more than they're designed to. We see patients who go to the emergency room seeking medical attention for non urgent situations. We see substance abusers who are frequent flyers at the ER, uninsured folks, and especially in rural areas, we see patients with low access to primary care. In many cases, there can be overlap between these categories. Also, as medicine advances, so does life expectancy. And that means that we have a lot more elderly folks running around and they use the ER as well. So let's give some historical context. Emergency rooms are a fairly new advent in the history of medicine, with the US being one of the early adopters in the 1960s, and one of the first ERs to open in 1961 was only staffed with 4 physicians. And prior to the creation of ERs in the US, emergency procedures requiring specialists were given to random physicians, regardless of expertise, as certain specialists were not on call all the time. Because many diseases have similar symptoms, it is critical to have certain specialists on call that can arrive in a timely manner. Well, now let's fast forward to today, and you'll see that the typical ER that you'll visit will have a number of physicians, interns, nurses, residents, and on call specialists on site. Now let's think about how people get to the emergency room. Sure, some will just drive themselves or have a loved one drive them, but a fairly large chunk of people who come to the ER arrive in an ambulance. And prior to the Federal Highway Safety Act in 1966, over half of all ambulance drivers are morticians from funeral homes that had no medical training. And thanks to the Federal Highway Safety Act of 1966, we now have some regulations and plannings and rules, along with training for those involved in the ambulances. As we may know as well, now more than ever, the media plays a very large role in our lives, and medicine is no exception to those categories affected. You see, media has promoted the value and demand of ER medicine. It has also created public expectations for the ER and spread word of the group of physicians that created them. Therefore, it encouraged people to use the ER and caused the utilization to grow. I mean, just look at television shows. Think about Grey's Anatomy, one of the most popular shows of all time, and how it depicts the emergency room along with other aspects of a hospital. So we've explained the issue, we've given a little historical background. Now let's jump into some nitty-gritty numbers and stats. So between 15% to about a quarter of ER visits in the US could have been managed in your regular doctor's office. And as many of us know, ER bills are fairly expensive. And this 13 to about 1/4 that I talked about could have saved about $4.4 billion every year in healthcare expenditures. And this trend of ER overutilization is one that we see growing the quickest in developed Western nations. And it has increased at a fairly dramatic pace. The majority of this is largely attributed to inappropriate and non-urgent visits. During the period between 1966 and 2009, there was a 35% increase in visits to the emergency room, with 90.3 million visits in 96 to 124 million visits in 2009. Again, that's a 35% increase. Like we mentioned earlier, the growing elderly population in the United States is one of the main culprits in ER overutilization, with about 60% of folks over 75 using the emergency room. Also, as we mentioned earlier regarding drug abuse or misuse, in 2009, with there being 136 million emergency room visits, about half of those were attributed to drug abuse or misuse. So we've given you an overview of the problem. We have given you some statistics. Now let's provide some opposing viewpoints. There are some researchers out there who have suggested that emergency rooms are not being overutilized to the extent described. From 2014 to 2015, over half of emergency room patients were self-referred rather than referred by a primary care physician. Also, there has been no evidence showing that uninsured patients use the ER more than insured patients. In fact, uninsured visits also present to the ER with similar circumstances as those who present with insurance. The CDC has also stated that only about 5.5% of emergency department visits are unnecessary. So now that we brought up a problem at hand, provide some details and a little counter argument to it, let's talk about who is out here to assist with this problem. Well, here in Arizona, Banner Health is one of the key organizations who are trying to help with the problem at hand. Banner Health was involved in the Federal Emergency Medical Treatment and Labor Act, which put in place guidelines for how to screen patients and determine whether they need emergency treatment or not. Ideally, this would lower the number of unnecessary visits to the ER for both non-urgent and substance abuse related visits. So who's in charge of Banner Health, who is essentially paving the path towards lowering ER overutilization? Well, that would be Mr. Peter Fine, CEO of Banner Health since 2000. Mr. Fine is a member of the American Hospital Association, Greater Phoenix Leadership, and the Banner Health Board of Directors, all of which can assist him in tackling this issue of overutilization. The American Hospital Association can provide Mr. Fine with advocacy in national health policy developments, and Greater Phoenix Leadership can assist him with addressing the issues as they pertain to Phoenix, Arizona. Mr. Fine has required the Banner Health Emergency Department to follow the Emergency Medical Treatment and Labor Act that we mentioned earlier to prevent this unnecessary usage of ER resources. Mr. Fine is also currently working on opening new facilities, such as primary care clinics, to better serve the community. This will allow greater access to those who currently do not have primary care physicians. And as we discussed earlier, one of the leading contributors to ER overutilization is a lack of number of access, is a lack of number of and access to primary care sites and physicians. Mr. Fine is the man in charge of Banner Health, so we know that he's technically a leader, but is he a good one? Well, from what we at our team have found, Peter Fine is an empathetic man. He recognizes others' successes throughout Banner Health and constantly mentions the Banner Health motto, which is making healthcare easier so life can be better, which would seemingly indicate that it is important to him and his vision. In an interview, Fine mentioned that the COVID-19 pandemic has affected his staff and the company. He shows empathy and sympathy towards staff that has been affected by the decisions made in the company to continue functioning. In the same interview, he was asked to describe what is the most rewarding part of his day, and Mr. Fine answered, "When I watch leaders develop and become better leaders." He talks about the chief clinical officer, Marjorie Bessel, and how she has stepped up for the company and grown to be successful in her position. Finally, Mr. Fine possesses trust. He stated a motto in an interview which says, visibility breeds credibility. Credibility breeds trust. If you want to be trusted, you better be visible. Now, we do not know Mr. Fine and the work he does on an intimate or personal level, so take our following feedback with a grain of salt. We would say that the traits that Mr. Fine should work on currently are interacting with staff in another way other than using direct reports. We would advise that he should also focus on gaining feedback from his staff. Interaction with staff members across the entire organization is extremely important for leaders to build relationships. In an interview, he describes that the current pandemic has made it quite difficult to interact with staff other than through his direct reports. So with that being said, it is understandable why he is only using direct reports. With all things considered, we'd say that he's doing a heck of a job, and props to him. Hopefully, the work that he is doing will eliminate the overutilization of emergency departments one day. And that's all we have for you. And I'm going to just scroll through our list of resources. So feel free to pause the video anytime if you want to fact check us or see what we're all about with our research project. All right. That's all we've got for you guys. Have a great day and be healthy.